Hello, it's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're moments away from bringing you a briefing from the South Korean health authorities on the coronavirus situation here in the country. Very soon, we'll cut into the briefing with simultaneous interpretation available for you in English. Director of Health Policy Yoon Tae-oh is expected to be giving us the details on the coronavirus situation in South Korea, filling us in on the number of new infection cases seen as of midnight. Also, he will be telling us what kind of efforts the government is making to contain the virus, especially with the increase of cluster infection cases. It looks like he's just taken to the podium and will be starting the briefing very shortly.
11월 4일 수요일
Let us now begin our regular briefing for November 4th, Wednesday. As of today midnight, we have 98 new local infections, and among them in the metropolitan area we have 84 cases and 14 in the non-metropolitan regions. And yesterday we had 2 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. Centering around the capital area, we are seeing ups and downs in the number of new confirmed cases. And we still have a higher number of on-day increase of the patients. And also we are conducting swift tracing and testing. However, we still have a faster pace of the infection spreading throughout the nation. And especially centering around the vulnerable facilities, including the nursing hospitals and long-term care centers, we are also witnessing cluster infections centering around group meetings as well as offices and other facilities that are very closely related to our daily routines. And if the current situation continues for the time being, we believe that the on-day increase could not maintain the 2-digit number and will surpass the 100 going into the 3 digits numbers. And still, until now, we are able to contain the virus to a large extent, and we do not have a massive outbreak. However, as the winter gets, as we get into the winter and the weather gets chillier, we believe that we still have a higher risk of infection as well. And along with the prolonged outbreak, in order to guarantee the routine daily lives as well as the economic activities of our citizens, it is very important that we maintain our quarantine measures. Nevertheless, we are witnessing some of the characteristics of the latest cluster infections, which seem to be difficult in the case for the quarantine authorities to manage and control. And therefore, we ask the public to continue to exert efforts to comply with the quarantine measures, including wearing face masks and washing of your hands, as well as keeping a social distancing. And looking at the latest trends, we have seen the virus spreading through eateries, music lessons, and saunas, as well as health fitness centers, where wearing face mask is difficult. However, people are engaged in various activities that increase the travel of respiratory droplets. And against this backdrop, we ask for you to wear your face mask at all times, wherever you are. And if you are going to confined areas, please take particular precautions to this end. And as for the multi-use facilities, we ask you to minimize the time of stay there, and please refrain from activities that increase the travel of respiratory droplets. And even at restaurants, aside from when you are consuming food, please wear your face mask. And at the multi-use facilities, not only the users, but also the managers need to also take particular precautions so that they need to also make sure that the quarantine measures are fully complied with. The government will also make sure that we look into the multi-use facilities as well as facilities that are vulnerable to cluster infections. We will exert our full efforts furthermore. And if you have any symptoms like fever or respiratory symptoms. In order to contain the virus from spreading, please refrain from going to work or going to school and get tested as soon as possible. And due to the prolonged COVID-19, we are also providing some measures to intensify support for mental health. And from August, we have collaborating and we have been exerting our pan-government efforts, collaborating with about 8 ministries so far, and we have carried out about 5 dozens of programs as well. And we have provided about 2.6 million cases of consultings in order to grant a more healthy mental state for our citizens. And we have had a consultative body to this end. However, due to resurgence of the virus, we were not able to sustain and expand this program. However, now, starting from now, these consultative bodies will be elevated to include and to be led by the vice ministerial level, and we will also expand the member of the consultative body, and so that we can have more effectiveness of the program as well. And we will also make sure that we have healthy mental state, and we will also initiate diverse programs. And we will have, and we will also make sure that you have a healthy mind and healthy physical health, and you take a good rest and also take a decent amount of walking as well. And we will also make sure that we have to keep social distancing physically. However, we shall maintain close distance mentally through video chatting as well. And going forward, we will also continue to cooperate with our government ministries and cooperate with local governments to provide any necessary support which are tailored to the people who are in need of these consulting sessions. And we will also provide a positive message to our citizens so that we can alleviate any burdens that they are facing. And we are also very much concerned of a twindemic which involves the spread of the COVID-19 as well as influenza as well. And we are making the test kits for diagnosing both of these diseases at the same time. And yesterday, our Ministry of Food and Drug Safety actually recognized and approved of this test kit, and this is capable of diagnosing both of the viruses. It means that within 3 to 6 hours, using just a single kit, we can diagnose both COVID-19 and influenza virus, and we can also shorten the time for the diagnostic as well, and it could also promote convenience for the medical professionals. And right now in Korea, we are carrying out clinical testings for vaccines and therapeutics, and they amount to about 25 of them. And we have many researchers taking part in this research. And as for the plasma donations, we also have many people who have been donating their blood after fully recovering from the COVID-19. And we would also like to thank you for your donations and your participation as well. And going forward, we also ask for more participation from the COVID-19 patients in order to develop our therapeutics as well, and to carry out clinical trials. And this clinical trial will be carried out after it is approved by the ethical committee. And currently we are focused on the antibody testing, antibody therapeutics, and compared to also other types of candidate therapeutics, the clinical trial that we are carrying out here in Korea are relatively safe. So we ask for your support. And as for the clinical trial, it is a very pivotal stage in the development of vaccines and therapeutics. Therefore, we ask for your participation. Thank you very much.
네, 지금부터 질의응답 시간을 가지겠습니다. 배석자분.
That was Yoon Tae-oh, Director of Health Policy for the South Korean government, updating us on the COVID-19 situation in the country. He just confirmed that South Korea had 118 additional cases of COVID-19 as of midnight, bringing the accumulated total to 26,925. Unfortunately, there were 2 new deaths from COVID-19, bringing the total death toll to 474. Well, that brings us to the end of our coverage of this morning's briefing. We will be back though at midday Korea time for our regular newscast with Mark Broom. Bye for now.